Welcome, Drew.
Thanks, Dad. Nice to be here.
Very honoured to be having this conversation with you today. Could you talk a bit more about yourself, about your background, where you grew up, your education and your work?
Yeah, sure. So I was born here in Victoria, in Melbourne, out in Dandenong, and spent my early sort of childhood here before moving to Tasmania with my family, where I initially started on Bruny Island, actually, which is a really small island to the south of Tasmania, and then finished off schooling in Hobart before moving to the UK. So I lived in London for nearly 10 years and worked over there, mainly in social care, so sort of child protection, children's services. I was actually a clinical therapist for a while.
Oh.
And then ultimately was running services, doing children and family sort of adolescents services, so reports to court as well as interventions to try and keep families together in times of crisis.
Yeah.
Moved back to Australia probably about 2006 and then took on a role with the Federal Health Department setting up the aged care regulatory system in Tasmania. And so worked there and worked in health and aged care policy for about 5 years before jumping out into the not-for-profit sector. And so I've always sort of looked at those areas where there's kind of that nice interplay between operations and service delivery and making an impact in the community, but also kind of that policy and sort of the economic side of it as well, which was my early studies at uni. So I've obviously done, postgraduate studies in management and leadership and those sorts of things, as everybody does as you go through your career. But yeah, I guess that's kind of my background and how I've sort of found myself in this work. And obviously the NDIS, I could see that there was a big opportunity to impact the lives of many people in Australia and want to be a part of that.